Can vaping affect your sexual health? Plus, what if you're not attracted to your partner anymore? Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, our own very own Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, today we have a special guest here to talk about enhancing sex therapy with psychedelics. But first, let's take on some viewer questions.
Here we go, Dr. Leah. A woman says, I have trouble relaxing when I'm receiving oral sex. I just get too into my head. Do you have any tips?
Receiving oral sex can bring about a lot of uncomfortable emotion to the surface. It can trigger insecurities, intense vulnerability, and pressure to perform. So instead of relaxing and enjoying yourself, you feel nervous about receiving oral sex and end up avoiding it altogether. But if you'd like to relax and enjoy receiving oral sex, I have some tips. One of the biggest barriers is worrying about what they think. So make sure your partner is enjoying it, and if you think they're not, you might want to ask what you could do to make it a little more enjoyable. Plus, just forget about focusing on an orgasm, right? Focusing on an orgasm puts a lot of pressure on you to perform, which can mess with your head in more ways than one. You can see in many cases, pressure to orgasm actually prevents you from reaching climax and only makes you more self-conscious about receiving oral sex. On average, a woman needs at least 12 to 20 minutes of stimulation to orgasm. This varies, but 12 to 20 minutes is usually much longer than most women give themselves space for.
Oh, 12 to 20 minutes. I'm going to keep that in mind. What can the partner do to help?
Well, connection is an important part of sex and arousal, especially for women. But it can be hard to connect with a partner when they're all the way down there. A lot of anxiety about receiving oral sex simply comes from the fact that it can feel distant and disconnected. But there's an easy fix. Find a way to feel closer to each other. Hold their hand or ask them to make eye contact with you. Find a position that presses your bodies closer together.
Okay, our next question. A man asks, can vaping cause sex issues? It seems like when I vape a lot, I can't get an erection.
Well, just like smoking cigarettes or using nicotine gum or patches, vaping is a method by which nicotine is delivered to the body, the whole body, including the reproductive organs. And there's a growing body of evidence that nicotine may be associated with erectile dysfunction in men, regardless of age and other conditions.
Dr. Leah, what is the physiological reason about nicotine that causes ED?
So nicotine has a vasoconstrictive effect, meaning it shrinks and tightens blood vessels, reducing the amount of blood flow that can get through them. This reduces the body's ability to effectively transport oxygen and can lower energy levels and shortness of breath. Getting and maintaining an erection is dependent on a strong, steady flow of blood into the spongy tissue and smooth muscles of the penis. During sexual arousal, certain chemicals in the lining of the blood vessels in the penis allow the penile muscles to relax and accept the additional blood flow. These same chemicals then create a seal to trap the blood into the penis, creating an erection. Therefore, men who smoke or vape are at a higher risk for experiencing erectile dysfunction. Sexual health then may be further diminished by the man's emotional response to the incidences of ED, which may include shame, depression, anxiety, and feelings of inadequacy.
That you know of, have studies been done on the link between vaping and sexual health in men?
Well, the effects of vaping on sexual health in men is supported by an increasing number of studies that link its use with erectile dysfunction, loss of libido, and slower arousal times. In fact, it's been found that men who vaped on a daily basis were more than twice as likely to experience ED when compared to those who had never vaped. Research also shows that health problems, including sexual health issues, are directly related to how much nicotine is used. In other words, the more you vape or smoke, the worse its effect will be on all aspects of your health.
Okay, gotcha. A woman says, I'm pregnant and it's killed my sex drive. I have zero energy and I know it's affecting my husband. Please help.
Well, it is a popular belief or misbelief that a woman's libido or sex drive will inherently increase during pregnancy, but often just the opposite is true. While increased blood flow to breasts and genitals can result in greater sensitivity and the potential for arousal, Other factors can seriously undermine a pregnant woman's sex drive. Pregnancy triggers significant hormonal changes in preparation for the birth of your baby. These same changes can elicit feelings of happiness and optimism one day and then plunge you into a vortex of anger and despair the next. While these fluctuations are perfectly normal, they can leave you feeling drained and exhausted. When it comes to sex drive, the sudden surge of progesterone and estrogen during the first trimester can have a contradictory effect. The sensory overstimulation may leave you feeling edgy rather than energized. Morning sickness and fatigue are also common, and neither of these will enhance that sexual desire.
Is this for the whole pregnancy or just certain trimesters?
Well, by about week 10, things might start to turn around. Your elevated hormones will begin to drop, and many of the adverse effects of early pregnancy, such as nausea, queasiness, and vomiting, should also subside. Also, as energy levels recover, your sense of well-being and sexual desire may also recover. At the same time, an increase in vaginal lubrication, accompanied by the engorgement of the clitoris and vagina, could enhance both the quality and frequency of sex. It is not uncommon for women to report being orgasmic or even multi-orgasmic for the first time in their lives during their second trimester of pregnancy, due to all the physiological changes that they are experiencing. But in the third trimester, things can swing in the opposite direction once again. Weight gain, back pain, and other symptoms can make getting in the mood all the more difficult as you approach your due date. Still, this isn't the case for every woman. Many enjoy sex just as much in the later stages of pregnancy, although they may have less of it.
Still to come on Sex Talk. Infertility causes. Psychedelics and sex therapy. Don't get catfished.
When it comes to infertility, there are a lot of factors at play for both men and women. Here are some of the common causes.
Infertility affects millions of people worldwide, and while it can be a difficult topic to discuss, understanding its causes is essential for seeking support, guidance, and exploring available options. One of the primary factors influencing fertility is age. As women age, the quantity and quality of their eggs decrease, making conception more challenging. Men's fertility can also be affected by age, with a decline in sperm quality observed in older males. Understanding the impact of age on fertility is crucial, particularly for individuals or couples considering starting a family later in life. Structural abnormalities within the reproductive system can affect fertility. Blocked fallopian tubes in women can prevent the egg from reaching the uterus, while conditions such as varicocele or blockages in the male reproductive system can affect sperm delivery. Lifestyle choices and environmental factors can influence fertility. Smoking, excessive alcohol consumption, drug use, and high levels of stress can all negatively impact reproductive health. Additionally, exposure to environmental toxins, pollutants, and certain chemicals can affect fertility in both men and women. Other causes include hormonal imbalances, genetic factors, and health conditions. Talking to a healthcare provider can help someone navigate these factors.
If you're dealing with infertility, talking to a specialist could help. Coming up, what to do if you don't feel attracted to your partner anymore. Plus, we'll have tips to avoid catfishing on apps and online dating. Up next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have a colleague of mine, the Chief Innovation Officer of NTM AI and author of Transforming Orgasms with Psychedelics, Cannabis, and Science. Nathaniel Morris, thank you so much for joining us.
Thanks for having me.
Great. Today we're talking about psychedelics and sex therapy. Can you share with our viewers what that combo really looks like in practice?
Sure, absolutely. One of the interesting things that has emerged from all the recent interest in the therapeutic applications for psychedelics is that if you talk to people in the space, almost everybody on their own has explored psychedelics in a sexual context. And there's an increasing recognition that there's enormous benefits to be had within that space. But we're the first company to actually pursue that as a treatment course.
Great. So what is used? I know that we're looking at MDMA, but what are some other psychedelics that are commonly used?
MDMA is one of great focus, and there's enormous potential there. Its original application was in couples therapy, so it's kind of an obvious choice. But anecdotally, when we speak with people about their experiences, LSD often comes up, as does mushrooms, and peyote specifically has mescaline in it, which is an organic close relative of MDMA. And there's other minor chemicals within the peyote plant that are of interest in the sexual context as well.
Have you seen that the outcomes are better with one particular psychedelic than another?
It's interesting. The type of psychedelic is absolutely relevant, as is the dose, but one of the most significant factors is what we call set and setting. The headspace that the person is in and the environment, both the physical and the social environment that they're in, has an enormous impact on how people experience the substance. And interestingly, another enormously important factor is the music that's playing. And there's been clinical data showing that the type of music that a person is experiencing during an experience is more impactful on overall mental health applications than the substance or the dose. So the set and setting seems to be the ball game in this space.
What type of music is the best type of music to listen to if you're on psychedelics?
It's a fascinating answer. So a big part of my work is about hacking that exact question. And the types of music that we associate with cannabis and psychedelics have something in common, and it's called polyrhythms. Now, polyrhythms in music theory are what makes some music more danceable. You know how some music, maybe you love the lyrics, but it's just kind of hard to dance to it. And other music, maybe it's kind of annoying, but you can't help but kind of shake to it. The scientific explanation for that is polyrhythms. And what that is different rhythmic time signatures layered on top of each other. And that's what creates these physical sensations of building momentum or tension and release and all of these things that make people dance and boogie. And the types of music that are associated with that are the types of music that we associate with cannabis and psychedelics. Like originally the jazz scene is famous for its polyrhythms, but then with the rave scene, that was electronic music, and that was the first time we had computers that could mix our polyrhythms for us. And anytime you go to a music genre that features polyrhythms, it's the audience and the musicians are always like super into cannabis and psychedelics. And that's not a coincidence. It's because cannabis and psychedelics can enhance the experience of polyrhythms. That rhythmic entrainment experience that comes out of polyrhythms is intensified by cannabis and psychedelics. And that's also the reason why they're impactful in a sexual context, because sexual stimulation is at its core a rhythmic experience. And by enhancing that rhythmic experience with cannabis and psychedelics, you can increase the whole cannabis rhythmic entrainment process.
Absolutely. So one last question. What do you think is the greatest misconception about psychedelics?
I think the biggest misconception right now is that it's a cure-all for all things. And I think I'm concerned that people might be overplaying the applications. And I think it's a wonderful tool, but it's not the be-all end-all. It's one of many applications that can be helpful. And I'm particularly interested in how it can be used in combination with technologies and music therapy and other things. So it's not in and of itself the answer to everybody's problems, but it's a wonderful tool.
Wonderful. Well, thank you so much. We'll be right back with more Sex Talk.
Still ahead on Sex Talk. How effective are IUDs? Medications can impair sex drive. Watch out for catfishing. Rekindling romance.
Back here on Sex Talk, let's take some more questions from our viewers.
Absolutely. A woman asks, do you still need to use condoms if you have an IUD?
Yes, you still need to use a condom. The IUD protects you from pregnancy, but it doesn't protect you from STDs. Condoms are the only form of birth control that also protects you from STIs or STDs. So even if you have an IUD, it is still a really good idea to keep using those condoms.
Okay, so how effective is an IUD?
Well, the IUD is more than 99% effective at preventing pregnancy, making it one of the most effective forms of birth control around. Since the IUD is inserted by a healthcare provider and it can stay in for years, you can't forget it or use it incorrectly. The Paragard IUD is effective immediately after it is inserted. The Marina IUD is effective immediately if it's inserted within 7 days after the start of your period. If it is inserted anytime after that, you will need to use a backup method of birth control for 7 days. So either way, it's safe to say that at this point, you should hopefully be able to depend on your IUD to prevent pregnancy. However, absolutely nothing is foolproof. I had a friend of mine that was newly married, did not want to have another child, so she had an IUD inserted. She later found out that she was pregnant. Obviously, it wasn't planned, but she and her husband were happy about it at that point. Unfortunately, fairly late into the pregnancy, I can't recall how late, but fairly late, found out that the IUD actually then terminated that pregnancy, which was really, really traumatic. And then she had to go into the hospital and essentially like give birth to the fetus. And it was, she had a lot of guilt, which, you know, obviously wasn't her fault. But I will tell you that it has traumatized me. So it's not something that I would ever do simply after watching her go through both the physical pain and emotional pain of that.
Wow, okay, I'm sorry to hear about your friend, and nothing's 100%, maybe just abstaining. That's probably the only thing you can do if you want 100%.
Oh, yeah.
Okay, our next question, Dr. Lee. A woman says, my 61-year-old husband claims he has no sex drive. I'm only 55 and I want to have sex. What can I do?
Well, there are many reasons for decreased male libido, including medication. Surprisingly, this reason is often overlooked. Prescription drugs, as well as over-the-counter drugs, can have a distinctly suppressing effect on a man's desire for and interest in sex. Prescription medications that belong on this list include antidepressants, tranquilizers, anti-ulcer drugs, diuretics, antihypertensive medication, those are for high blood pressure, psychotropics for any mental illnesses, opiates for pain, non-steroidal inflammatories. The list goes on and on, right? Depression is also commonly overlooked. It is a real sex drive killer.
What's a psychotropic you mentioned? What is that exactly?
So it's going to be anything that's going to be affecting your psychosis.
Okay. Okay, could this be a relationship problem, perhaps?
Well, yes. In some cases, the role of relationship issues in precipitating sexual dysfunction is fairly obvious. And others, it's harder to discern. Some couples mistakenly believe that they can leave unresolved conflicts at the bedroom door. Perhaps you and your spouse need to do some soul searching. Do you have good conflict resolution skills? Are you subtly putting down your husband or disrespecting him in other ways? Or has his stress level increased and that's just bleeding into your relationship? All of these things can be a factor.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Catfishing is when someone uses a fake identity to connect with someone else, which is becoming more common, especially in the online dating world. Here are some tips to avoid this scam.
In the world of online dating and social media, the phenomenon of catfishing has become increasingly prevalent. Catfishing occurs when someone creates a false identity or persona online to deceive and manipulate others. While falling victim to catfishing can be emotionally and psychologically distressing, there are steps you can take to protect yourself. First of all, trust your gut. If something feels off or too good to be true, listen to that inner voice. Pay attention to inconsistencies in the person's stories, vague answers to direct questions, or evasiveness about meeting in person or video chatting. Before fully engaging in a relationship or friendship online, conduct some research. Start by searching the person's name, photos, or any information they've shared with you. Cross-reference their social media profiles to verify their authenticity and look for any red flags. One common objective of catfishing is to manipulate victims into providing money or personal information. Be cautious if the person you're interacting with starts asking for financial assistance or shares stories of hardship that seem suspicious. Be safe. If you meet in person, be careful. and never disclose personal details like your address or financial information until you've taken all necessary precautions.
Anyone could fall victim to fake profiles online, so do your due diligence and be careful about meeting someone you haven't met before. For example, if you're setting up a first date, try going out in a public place instead of having them meet you at your house. Now let's take on some more questions.
Okay, here we go. A man says there are some spots on my penis. What could it be?
There are several conditions it could be, including pearly penile papules. Say that 3 times quickly. These are small flesh-colored lumps normally found on the head of the penis. They usually go all the way around the penis head in 1 or 2 rows. These lumps are normal. They're usually not sexually transmitted or caused by bad hygiene. They do not cause symptoms and do not require treatment.
You know, you maybe have a note from your doctor in case your partner says, what is that?
Yeah,
You know,
I mean,
like,
I have to admit, so I'm not, like, yeah, the guy might be like, oh, it's just fine, you know,
Yeah,
this is
right.
the triple B, it's not an STD.
nothing there,
Yeah, I mean, the reality is get it diagnosed. So it may not be a problem, but go see your doctor to make sure.
Good advice. We don't have a lot of information, so what are the other possible conditions?
Well, it could also be a lymphocele. This is a hard swelling that suddenly appears on the shaft of the penis after sex or masturbation. It happens when the lymph channels in your penis are temporarily blocked. Lymph is a clear fluid that forms part of the body's immune system. The swelling should soon subside and will not cause any permanent problems. Another possibility is non-infectious itchy rash that are purple and red bumps that can affect many areas of the body, including the penis. And there are also genital warts, which are small fleshy growths or bumps that can appear on the shaft and sometimes head of the penis under the foreskin. They are caused by human papillomavirus or HPV, which is a sexually transmitted infection.
Okay, thank you. A man says, my wife is very sensitive when I stroke her vagina. Maybe he's doing it too hard, I don't know. Are there any special techniques for this area?
Well, all right, so let's talk about the difference between the vagina and the vulva. The vulva is composed of external female genitals, including the inner and outer labia, the clitoris, and the opening to the vagina, right? And also the opening to the urethra. The vagina is part of the internal female reproductive organs, which also include the ovaries, fallopian tubes, uterus, and cervix. So it really depends on whether it's the inner part or the outer part that's too sensitive. The skin of the vulva is very sensitive, so irritation of this part of the body is very common. Common causes of irritation include sweating, wearing tight clothing, eczema, or dermatitis. Personal hygiene issues, product allergies, infections, and skin conditions can also be an issue. There's also friction and pressure from either fingering or oral sex, which can cause irritation to that sensitive genital area.
Our last question of the day, Dr. Leah. A woman says, I don't think I'm attracted to my husband anymore, but I still love him. How can I go back to how I used to feel? If that's even possible.
Oh, I mean, I do think it is possible. So I think you want to start off with what made you unattracted to him, right? So is it that he lost his job and so now he's just kind of sitting around being lazy and not really doing anything? That could certainly make somebody unattracted. Is it because he cheated? So now you don't trust him. So assuming these aren't major life things that are affecting your attraction level, then really just focus on what made you attracted to them in the first place. So rather than being like, oh, he has this weird mole and now I think it's gross, you know, focus on like, oh, I really love his beautiful eyes and his beautiful smile or whatever it is. If it is lifestyle, I would definitely suggest, you know, encouraging the person to work out. If they just gained a massive amount of weight for no reason or whatever it is, you can encourage them. But the other thing that people miss is that having sex makes you want sex more. It's just the reality of it. So scheduling a time, I know it doesn't sound sexy, but scheduling a time to have sex makes you want it more. And just in the same way that not having sex makes you more accustomed to that and can also often deteriorate sex drive.
I guess like working out, if you have a good routine going and you miss a day or two, man, you start feeling bad about yourself, you start feeling fat and all that. But, you know, she didn't mention that, you know, their ages. Sometimes people change as they age.
I mean, hopefully the person isn't just focused on the superficial. I mean, everyone's going to lose some of that beauty with age. So hopefully that's not just the focus. I would think that it would be more all of a sudden a huge lifestyle change. But like you mentioned, exercise, it is incredibly true, right? Like I work in exercise and sports science. People that have to work out almost every day, and I know friends of mine, my husband's one of these, cannot miss like a day at the gym, otherwise they just freak out, right? I'm good with 3-4 times a week. I'm fine with that. But if I missed a week, I would end up feeling really lazy and not good, right? So same thing with sex. If you're having sex regularly, it feels weird not to have sex for a whole week. But if you're just not having sex regularly, then you get comfortable with it.
Right, so if she tries all these tips that we just gave her and nothing seems to be helping, I guess maybe talk to therapy,
Absolutely.
mental health. Yeah.
Absolutely.
Right?
So I would honestly, in this case, suggest both couples therapy because you want to see if there's an underlying issue. Right. And then obviously there's sex therapy that is going to be focusing more on getting that attraction up and getting back in the bedroom.
Yeah, because that seems to be her issue, is the sex part that's really...
But sometimes that could be a result of an underlying issue. So that's why you might need psychotherapy as well. But hey, there's no harm in trying both and then seeing where it goes.
Dr. Lee, I'm so glad I work with you. I learn so much every time I'm on these shows. You know, thank you.
I feel the same way.
Thank you.
Well, Derek, that is all the time we have today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.